Good afternoon. Thank you for joining us once again for our daily briefing. COVID-19 is still out there. Our objective remains to keep you safe and also to keep you informed. So again, today we'll be repeating our public health message. I'm joined today by the Acting Medical Director, Dr. Krish Rawal. I will start with an update from A&E and with the latest test data. Remember that anyone who has symptoms of COVID-19 should call 111 first. In the last 24 hours, there were a total of 36 attendances at A&E. 10 of them had COVID symptoms. 5 were swabbed. There was 1 admission to the COVID CCU and 3 admissions to John COVID ward. This morning, those test results were being awaited. The latest data is as follows. Total swabs, 2,105. Results pending, 74. Results received, 2,031. Confirmed cases, 133. Active cases, 2. Recovered, 131. The 2 active cases are both at home. The grand total of 2,105 tests so far represents some 6.6% of the population. In terms of tests done per million, Gibraltar is now ranked 5th in the world, behind Iceland, the Faroe Islands, the Falkland Islands, and the United Arab Emirates, and in front of Malta, Luxembourg, Bahrain, San Marino, and Estonia. These are presently the global top 10. The Cabinet met this morning for the 3rd time this week. Ministers continue to review the overall situation here and to look closely as well at what is happening elsewhere. Coronavirus COVID-19 is new. We have said this many times. Studies, tests, and trials are underway. That science will determine how we react. In turn, the science will determine the advice that we give to you. And clearly, that advice must be tailored to the circumstances of Gibraltar. However, as the science moves, that advice may move also. This means that things can change. The World Health Organization itself has made it clear. Bearing that in mind, the Cabinet today went over elements of relaxation from lockdown in relation to education, in relation to business, and in relation to those over 70. A draft paper will be prepared over the weekend and discussed at the next Cabinet meeting on Monday. It will also be discussed with the opposition. An announcement will be made when that process is complete. I said that Gibraltar has had a total of 133 confirmed cases of COVID-19, 61 male and 72 female. It is relevant to break that number down further by age. 27 patients were in the up to 0 to 30 age bracket. This is 20% of the total. 66% were in the 31 to 50 age bracket. This is the largest single group of 50%. 32 patients were in the 51 to 70 age bracket, or 24% of the total. And of the 133, only 8 patients were over 70. This is 6% of the total. Less people have been infected in the over 70 category than in any other. In a sense, this is hardly surprising. The reason for this is the action taken to protect them, swift and decisive action, early on. You will recall that on the 11th of March, we advised the elderly to stay at home. This was a prelude to a complete lockdown. So a number of conditions have now been met, so options are being explored to allow those over 70 to exercise outdoors. We have shared some of those ideas with you already. These are still under review. But whatever may be agreed going forward, the advice is the same. You will always be safer at home. Despite the numbers today, there is no room for complacency. We are not out of the woods yet. Moving on, I am pleased to announce a new initiative in my capacity as Minister with responsibility for the Gibraltar National Archives. This will be interesting for the community as a whole, in particular for those over 70. Over the years, many have enjoyed the exhibitions organised by the archives. These have commemorated important historical events. The 75th anniversary of VE Day is 2 weeks away, on the 8th of May. Given that we are in lockdown, an exhibition to mark this occasion had to be postponed. We will aim to hold the exhibition later on in the year. The elderly often make use of the archives, both physically on site and virtually online. The team at the archives have worked hard, and more material has been placed on the website, even though the staff have been deployed to the field hospital. Some of this work has been done from home. Over 30 videos are now available. These cover the wartime evacuation, the 1967 referendum, the closure of the border, and different periods in our history. A short feature called Gibraltar, Britain's £50 million fortress, is part of this new collection. This footage dates back to 1911 and is considered to be one of the earliest film clips of Gibraltar. I would urge everyone, young and old, to have a look. Watch this and the other videos during lockdown. They can be found on the archives website. This is nationalarchives.gi. Many thanks to Anthony Pitaluga and to his team. Meanwhile, COVID-19 continues its ferocious rampage through the planet. And Gibraltar is not an island. We have been relatively spared so far, but we do not exist in a vacuum. We are connected by land to Spain and by air to the United Kingdom. This makes it important to monitor what happens in both countries. Sadly, the death toll in UK continues to rise, now to over 18,000 people. However, the number of UK arrivals is nonetheless very low. Only 78 passengers flew into Gibraltar last week, and 70 flew out of Gibraltar. The same week last year saw over 5,000 passenger arrivals and a similar number of departures. Yesterday, a passenger was sent back to the UK. He was in transit to Spain, and for this, a residence permit is required. He carried a photo of his residence permit on the phone, but not the actual document. However, there were extenuating factors. The BCA discussed the case with the Spanish authorities, and the passenger will be able to return and cross into Spain today, once the permit was verified. This lifeline service to Heathrow therefore remains important for persons, for post, and for goods. As we know, even more people have lost their lives in Spain than in the UK. Sadly, now over 22,000 persons. Cooperation with Spain throughout has been sensible and positive. We have helped each other when we needed to and put people before politics. That is how it should be, even more so in the face of a global pandemic that is still killing thousands of people by the day. COVID-19 has been the subject of conversation between the Chief Minister, with the Foreign Minister of Spain, with the Interior Minister, with the President of Andalusia, with the Mayor of La Linea, and with others on the other side. By air, Spain has assisted with passengers bound for Gibraltar, who were stranded in Malaga. By land, they have helped exceptional cases cross the border in either direction. I just gave an example of this. And goods continue to flow in through the border. Last week, there were 616 trucks coming through the East Gate. Many countries are discussing release from lockdown. Spain too. Spain is now taking small steps in that direction. Children will be able to leave their homes soon, and exercise outdoors will be allowed. Both are already possible here. Others are taking steps too. Denmark, for example, has opened primary schools. Clearly, Spain is more relevant to us than Denmark as we move out of lockdown, because it will have a direct impact upon us. There are small blessings, though. Andalusia is not one of the worst affected regions. In turn, Cádiz is one of the least affected provinces. And in the Campo, the virus has hit less severely than in other places, although there was a surge again yesterday. Spain continues to face a serious situation, and Spain is important precisely because of frontier flow. That flow has reduced considerably, from 36,300 people a day to 1,750 now. It is now under 5% of what it once was. However, a release from lockdown may lead to an increase in numbers infected and in numbers crossing. That is why we need to proceed very carefully and to monitor closely what happens next door. COVID-19 represents a danger to life. We know that. The spread of infection is fast, and the consequences can be deadly, particularly for those in the high-risk category. That is what is happening elsewhere. There are over 2.6 million people now affected in the world, and some 182,000 have lost their lives. This is tragic. The past, over history, has shown that there have been worse cases. Few now recall the so-called Spanish flu epidemic. This pandemic struck from 1918 to 1920, after World War I. The estimates are that 500 million people were infected. The Spanish flu also caused high mortality, particularly amongst the 20 to 40 age bracket, also amongst those under 5 and those above 65. It was the deadliest pandemic of the 20th century. The virus led to secondary bacterial infections. The top estimate is that 50 million people lost their lives then. So 500 million infected and 50 million deaths. So why the history lesson? Because the Spanish flu came in 2 waves. The second was more lethal than the first. And because there are always lessons to be learnt from the past. Gibraltar was not immune in 1918. Far from it. There were 600 cases here in the first wave. That was during the summer. And 21 people sadly lost their lives. The second wave hit us from September 1918. There were then 3,000 cases here, and 111 people passed away here in Gibraltar. The crisis continued until December 1918. I thoroughly recommend Dr. Benedi's book on the subject. True, that was a different virus, and true, medical advances then were not what they are today. Nonetheless, I use this as a reminder that we must not become complacent, that this is far from over, and that you must do what we ask you. The planet may be on the verge of a new era now, a world of temperature scanners, of disinfecting, of face masks, of testing, and of contact tracing, with new routines of social distancing, hand washing, sanitizers, self-isolation, and catch it, bin it, kill it. These routines will help, and we must all play our part. How long will this last? The truth is that nobody knows. None of us. The World Health Organization has made it clear that there is no quick end in sight. A new virus has created new challenges. But again, there is always hope. Clinical trials of vaccines on humans are now being conducted in the UK. Antiviral drugs are being explored. Testing has been increased. But there is no quick fix, no instant magic wand. The disruption to our lives is set to continue. For now, we need to adapt to this new situation. This is the new normal. So be strong, be sensible, be patient, be considerate, be careful, and stay safe. Before passing on to Dr. Awal, let me repeat our public health advice once again. Listen and act on the advice of our public health professionals. When you sneeze or cough, do so in a tissue and then bin it. Wash your hands regularly for at least 20 seconds. Do not visit anyone over 70. If you are over 70 or vulnerable, please stay at home. If you need medical advice, call 111. If you have any other question, call 200 418 18. And for emergencies, call 190 or 199 as usual. Stay home, stay alive. I now pass you on to Dr. Awal.
Minister, thank you very much. Good afternoon, everybody. I hope everybody is well and safe at home. Just to give you a few little updates from the GHA, hopefully answer a few of the questions that I've been seeing going around, particularly from my friends and from social media, things that I'm sure many of you are wondering about at home, and give you a little bit of an oversight of some of the research that we are seeing at the moment. So really first to concentrate on St Bernard's Hospital. You may have seen, some of you who are in the area of the hospital yesterday, some increased activity around the accident and emergency department. We are practicing and doing our exercises, which we continue to do and we will continue to do to keep our teams sharp. Yesterday was the St Bernard's exercise. We put 11 patients through the accident and emergency department to test our facilities there, see if we have any gaps in our practices, and obviously to improve those and just to test our staff. We've carried out exercises over at the field hospital, and next week we plan to do a combined exercise where we will include every single element going through from accident emergency, primary care and walk-ins, using the ambulance service as well, straight up to the field hospital to test every single element. So you may see increased activity, but these are for exercise at this point, and we will always give you an advance warning when we're doing exercises, particularly if we're putting ambulances on the streets, so that you're forewarned and there's nothing to worry about. Secondly, we have some plans going on at the moment. I'm engaging with my clinical teams, and we're looking very small steps, as Minister has said, for some restarting of clinical activity. I know I've said this before, and many of you are at home with pending appointments, wondering whether your appointments have been cancelled or forgotten, and whether there are medical conditions that you're worried about, and even little minor things that you think you're a bit unsure as to whether you should wait or whether you should seek help. So I will say, and I will repeat this really, if you have any concerns, please start by calling the primary care and book an appointment, maybe just a telephone consultation to start with, 2007 910, that's 2007 910. Seek some advice first, but my clinical teams are now thinking about how we can restart some clinical activity. And bear in mind that's not as simple as simply opening the doors once again. We have to protect the patients who are in the hospital, and we have to protect you. If we are inviting you back into the hospital, we have to make sure that that's done absolutely safely and we don't place you at increased risk. We will never place you at increased risk. So small steps with that as well, and as things move on, of course, we will let you know. Secondly, let's go through a little bit of the research that I've been keeping an eye on. There are, of course, lots and lots of papers coming out at the moment. Every research institution and every large medical institution is looking at the research and examining this virus. Some of these studies are quite small because we haven't got a long history with this virus itself, but a couple are coming out which have increased strength. One of them is they found that the inflammatory process in the lungs, if you have the COVID virus, is more pronounced if you are overweight. And this becomes consistent with some of the messages we've had about pushing and potentially bringing up your immune system by keeping well, eating well, looking after yourself, doing a bit of exercise within the restrictions. And the reason that this is happening for those who are carrying excess weight, and I'm saying overweight, I'm specifically in those who are carrying a lot of weight. I suspect we're all carrying a little bit of extra weight at the moment because we're perhaps not getting out as much. And Easter's just been and gone, and I know that I have a store of chocolate at home that I can't keep my hands off at the moment. So please don't worry if that's happened, but really this is a very, very good time now to just think about our health and boosting our immune systems in every way and looking at our lifestyle. Secondly, you may have been reading some reports in the papers about sleep apnea machines, otherwise known as CPAP machines, and those of you who suffer with sleep apnea at home will know exactly what I'm talking about. Some of the articles are calling these black boxes. The sleep apnea machines themselves help support somebody who may stop breathing for a period of time during their sleep and then start breathing again. And the machines are designed really to sense that and to help support breathing. So just a few things to say. Firstly, to those of you who have sleep apnea at home and are using a CPAP machine, There is no evidence at this point that the CPAP machine and the increased pressure of that machine when it drives the air through your mask, there's no evidence that this drives the virus deeper into your lungs if you potentially had the COVID infection. None whatsoever. But equally, there's no evidence that having sleep apnea increases your risk of coming to harm or getting COVID in the first place. So please, if you're at home, if you have a machine and your sleep apnea is well controlled, along with any other chronic medical condition, as long as it is well controlled, you are not at an increased risk. But if you have unstable medical conditions, or perhaps if you're a smoker, or perhaps if you are carrying some excess weight, which is actually contributing to your sleep apnea, now is a really good time just to have a little think about that and see whether we can do something about that. The story in the media about the black boxes has come from Warrington Hospital. And Warrington Hospital have been using these black boxes, the CPAP machines, as sensors to sense patients who have COVID-19 if they're stopping breathing. But there's a very interesting little statement at the bottom of this article which says the hospital normally has access to only 12 intensive care ventilators. And you've heard me talk about the figures many times about the number of ventilators that we have. At this moment in time, we have ready to go, as I speak, 57 ventilator machines, with more on order to arrive as we have well and truly anticipated this. And we have some single-use ventilators as well. And once our orders arrive, and potentially, if we had the single-use ventilators brought online as well, we could take this total up to over 100. So in comparison, while we have looked at the black boxes for the CPAP, there is genuinely no need to consider them at this time. Continuing on with the research, a minister mentioned about the vaccines. In fact, the UK have announced this week through Oxford University some trials on a vaccine. China and Germany are also carrying out trials on a vaccine. The trouble with this is that this is an uncertainty, and we don't know whether they may be successful. As you can imagine, there are many, many countries looking for a vaccine for this virus. But in the meantime, the simple things will still stand us all in good stead. Keep your immune system well and keep it strong. Look after yourself, eat well, keep active as best you can, try and lose a little bit of weight. Make sure that medical condition is well controlled, and if not, seek advice through our GPs. Another trial is talking about the throat swabs. Those of you who have actually been swabbed so far, and over 2,000 of us have been, or of you have been swabbed so far, the throat swabs, albeit that they are very unpleasant, there's some evidence to say that that even sputum samples might help, and we're looking into that very closely now to find out what's the most reliable way to get a positive result. And if there are any changes to that, of course, we will let you know. And then the final study, this is a very interesting study, a bit of a reassurance perhaps. Lots of evidence and research is coming out of Wuhan, as you can imagine, as they had very high numbers of people. 19 babies in Wuhan born to COVID-positive mothers. So these are mums who actually had the virus when they went into labour and when they had their babies. And not one of those 19 babies showed any evidence of the virus in their systems for up to the 2 weeks afterwards. None of them became unwell. So this is a very interesting and quite important study, and I know you'll be thinking, well, there's only 19 babies, but this is quite an important study because I suspect if there are any of you who are at home and are pregnant, you'd no doubt in my mind that you'll be worrying about this and wondering. We have done some reassurance in the past. We've spoken to you about the evidence through the Royal College of Obstetricians and Gynecologists, but this study actually lends some weight to that. So if you have been worrying about that, please be reassured there is no risk to you and there's no risk to your baby, and certainly no risk to you in terms of increasing your risk of COVID-19. However, the same things apply. So look after yourself, keep yourself well, because you're going to need to be strong anyway to have your baby. But please be reassured that at the moment there's no evidence to concern us. Moving on to one question from home, which I know is a question that I've been looking at quite often. And many people have asked this question about the swabbing side of things. The Minister also said to you about where we rank. 5th we rank. So Gibraltar is ranking very well in terms of the numbers of swabs that we've carried out. To put that into perspective, that means the equivalent of 70 swabs per 1,000 population, or in fact 1 in every 14 of us would be swabbed at this point, bearing in mind the 2,100. So the question then is, why do we not swab everyone? Well, the first thing to say about that is that we would then, of course, in one go, use 30,000 swabs. The second thing is that the swab itself only provides a snapshot of the picture at any particular moment, and things can change, of course. And then perhaps the next few days or the next week, things are almost reset again, and we may potentially have to go again. So really, the reason I'm bringing this up is because I know people have even asking this question, but we must stick to what has stood us in excellent stead over the last few weeks, which is good clinical practice with our clinicians who are now gaining enormous experience with this and know exactly when to swab and when not to swab. And sometimes during these press and information conferences, when we give out the A&E statistics, you will see there's a difference between the number of patients who came with the symptoms and the number of swabs we've done. And that's because we apply good, sound clinical criteria as to whether we swab or not. But just to move on from there, the Director of Public Health is planning to do some further sampling, and he will give you further information on that. But we're planning to certainly start with frontline healthcare workers and frontline workers and do up to another 500 swabs a week. And that will give us a more clear picture. And also we're identifying staff in these frontline areas where they're more likely to be in contact with you in the community and more likely themselves to potentially be in contact with the virus. Now, just a couple of final points, really. The primary care centre opening times, as I'm sure you're all aware, that primary care and, in fact, the GHA generally, we're approaching a couple of bank holidays next week. So primary care team have asked me just to let you know that for the Tuesday bank holiday next week, it's business essentially as normal. And then for our Friday, May Day, we're down to a morning clinic with full complement of GPs in the morning clinic and in the evening clinics for you. So if you want an appointment, call 2007-910. That's the best number for you to call for any advice at all in terms of timings, in terms of having an appointment or a telephone consultation with your GP. I would also ask you, even though there are only 2 days of the bank holiday next week, please check your repeat prescriptions. Make sure you're not on the point of running out, and plan ahead. If you do need a repeat prescription, call the PPAU on 2000-7909. That's 2000-7909. Or in fact, you can email them on prescriptionrepeats@gha.gi, and these details are available on all the government websites. And so now on to some very, very important points. I would like to say a huge hello and thank you to Amelia. Now, Amelia is 8 years old, and Amelia is an absolute shining example of this amazing community. She arranged a mini-mile marathon and worked out that where she lived at Buena Vista Park Villas, from one gate to the other gate, if you go 16.5 times, that's a mile. So she's organised with her sister Charlotte and her friends, and they've taken it in turns into sibling groups, so only family groups, so they've maintained their social distancing, and they've gone together. So Amelia and her sister Charlotte, along with their friends Hugo, Lucas, Leo, Savannah, Holly and Robin, who's only 2 years old, and each of them have run a mile to raise money for the GHA. They kept their social distance and they have raised £570 for the GHA. So all I can say after they got their medals and they got their certificates is, Amelia, you and your sister and your friends are amazing. So thank you to you all, and thank you to Buena Vista Park Villas for some very, very much appreciated support. And I'd also like to say hello to Erin Berry, Louise Doolan and Rebecca Hassan, who sent me their lovely rainbow cards, which I have here. So thank you very much indeed. So now my final thoughts. I'm sure I'm feeling the strain of this now, and I know that you are. I'm certainly missing my friends, and I'm missing that perhaps more relaxed element of living that I probably didn't appreciate until it's now disappeared away from my life. And I would consider myself to be one of the lucky ones, as I get to leave the house and go to work and keep to a routine. And I'm sure there are many of you at home who are definitely feeling the strain of this one. So please, I would say to you, let's not trip at this final hurdle. Let's not lose our strength. So keep strong, keep going. And for those of you who thought you would get away with not doing that final DIY project because we were going to release the restrictions, I'm sorry to say that you're going to have to carry on with that one for the moment. But keep strong, keep going for the moment. Don't lose your strength, don't lose your resolve. And I'm certainly not one for quotes, but I'm sure you've all seen the picture of me on Facebook. And there's a quote above my picture which says, calm is a superpower. And I think this is absolutely the point where we must keep calm, keep strong, look after yourselves, look after each other, and we will get through this. Thank you.
Thank you very much, Krish. Are there any questions?
Yes, thank you both. Our first question today comes from YGTV, and it's for Dr. Rawal. Future plans include a more aggressive testing regime, temperature controls at entry points, contact tracing, and the isolation of positive cases. Which measures will be mandatory and backed, if necessary, by law?
I mentioned that earlier, and Minister also mentioned that about how we're going to change the way we have to live. We're genuinely going to have to do that, and you're right. We are going to be testing more aggressively. We're starting that next week. Temperature controls at entry points. Certainly, there is evidence about checking temperatures to catch fevers on those people who don't have any symptoms. Much stronger with our contact tracing, isolating positive cases, exactly as you said, and of course the hand gel. So, of course, there's never an intention to make anything mandatory or backed by law. And we would certainly introduce these measures as best we can, asking everybody to be absolutely aware that doing this is a very, very small, few seconds part of your day. And the places that we would suggest we do some of these things, such as the temperature controls, the alcohol gel, will be in places, border entries into the hospitals, into places where people will congregate. And a hospital, for example, is a place where there are vulnerable people. So, of course, we will ask people to do that. But at this stage, we are putting these things in place. We're watching what other countries are doing to find out what it is that's best practice. And that's something that we will always do. We'll never do anything that is not tried and tested. But if there is something that's best practice, we'll do it straight away. So we'll try not to mandate and back these things by law, and we will ask people to be totally mindful that by doing it, they're looking after themselves, they're looking after vulnerable people, they're looking after their families and their friends. So we're doing it for each other. And the one thing you can absolutely say about this community is that we work for each other. So I don't doubt that we will all be able to do it. But equally, if we find that these things are very difficult to put into place and we need more strength in terms of reinforcing those, of course we will visit that. But at this stage, I don't think I'm in a position to say what that would be in terms of changes to law.
Thank you, Dr. Rawal. Our next question is for Deputy Chief Minister, and it's from the Olive Press. Is the government accepting surrender of commercial leases and transfer of premises after some tenants have had to relocate or shut down to survive or cut costs? Is there any further help the government can give these helpless victims of COVID-19?
Well, first of all, let me say the government has already introduced a package of considerable assistance, and the objective of that package is to reduce businesses' operating costs, including rents, where the government is the landlord, and encouraging private sector landlords to follow suit where the government is not the landlord. But I have received no indication myself that there is some kind of mass surrender of leases going on or people requesting transfers. It may be that there are, but it's certainly not something which has come to me yet.
Thank you, DCM. Our next question is from the Chronicle for Dr. Rawal. The GHA has done an amazing job preparing to counter the threat of COVID-19, but as a result, a lot of routine yet vital services have been scaled back or stopped altogether. How concerned are you that part of the price of this response will be harm from non-COVID related disease that might otherwise have been avoided? And are you satisfied that enough is being done to minimise this risk, particularly in the light of declining infection rates?
Well, there are lots of elements to that question, but I mean, the first thing to say is that that myself and, of course, all the clinical teams are absolutely concerned about all of our patients at all times. And the decisions that we make on a daily basis are based on risk, really. What represents greater risk to somebody, whether that's coming into the hospital and potentially putting somebody at risk of catching COVID, or whether that's at the risk of not dealing with a medical issue. So, of course, we put lots of things in place already, which people are very familiar with in terms of the telephone and video consultations, lots of different support lines and telephone lines. We have brought people into hospital if necessary. We have carried out many, many procedures actually during this time. The hospital itself has not been completely shut down. And, for example, patients on the 2-week wait times for cancer have been brought in and have had their treatments and been looked after. So at this point, as I said earlier, we are engaging, or I am engaging with my clinical teams to see what we can now put into place. Bearing in mind that at this point, we have a COVID-free hospital, which is an amazing thing to be able to say at this point. So we must bear in mind that the things that we put in place are safe to put in place. We do them slowly. It's not as, like I said earlier, it's not as easy as simply opening the door, but we also want to put things in place such that if we did have a surge in cases, we could actually put these things aside again and stop some clinical activity, looking after the people that are most sick. So it's a bit of a balancing act, but I can absolutely assure you, and I'm definitely satisfied, that my teams are absolutely driven to bringing things back online, slowly but surely. In fact, sometimes they're really driven to it, and we have to calm things down. We have to think. We have to make everything right. So please, everybody listening at home and watching at home, please be reassured that we have absolutely not forgotten about all the other things apart from COVID.
Thanks, Dr. Rawal. Our next question is also for you, this time from the Panorama. The Director of Public Health, Dr. Bhatti, says that Gibraltar has been lucky so far to get away so lightly with COVID-19, that the most dangerous times are ahead, and that he is worried. What do you say?
Well, you know what I would say? The first thing I would say is that I don't think we've been lucky. I think that we have done this ourselves. Of course, there's going to be an element of luck because this is a virus which is unpredictable and we don't really understand. We can't see it. We can't stop it blowing in the wind. Chief Minister said that a very long time ago. I'm sure everybody remembers that. It would be like stopping the wind. But I don't think this is entirely down to luck. I think this is entirely down to a community that listened to the advice, a government that was very, very proactive, very wise and very timely putting things in place, and a community who actually accepted that very, very readily and took the advice at some considerable hardship, I would have to say. Many people have found this very, very difficult. In terms of the future and whether we need to be worried at this point, as Deputy Chief has already said, this is an unpredictable thing. We keep an eye on our neighbours. We don't know if this is coming again, and we are in a process now where we are going to gradually unlock, and I'm sure that we'll have a rise in cases because of that. But I would absolutely stand by any statement that says that I am absolutely proud of the GHA. We are ready and then some. And we will look after everybody, and I personally would rather not be anywhere else apart from Gibraltar at this point. So I'm sure that anything that comes our way, we will take care of it.
Thank you, Dr. Awal. Our next question is also from the Panorama, this time for Dr. Garcia. Is there any new information regarding the airport, such as when operations might return to some normality?
I think whatever happens at the airport in terms of flights to other destinations is not only dependent on ourselves here in Gibraltar. Obviously, it depends on the other side that receive the flights or where you happen to be flying to. I think it's very good that Heathrow have maintained, British Airways have maintained the air connection with Heathrow. They have actually cancelled flights worldwide, even flights to other parts of the Iberian Peninsula. So I think it's good that that link has been maintained. I know my colleague, the Minister for Tourism and the Minister for Commercial Aviation have been in discussions with EasyJet as to when it is that they want to resume flights and to what destinations they would want to resume them. But I think it's still too early to tell, and we need to see how all this settles down and how all the pandemic evolves in the next few weeks.
Thank you, DCM. The next question is also for you from YGTV. The government says it will do whatever it can to ensure that no business faces insolvency as a result of this crisis. Despite the beat measures and landlord discounts and other help, is it inevitable that certain businesses in some sectors, like catering, will in fact have to shut down?
Well, first of all, let me say, as I said earlier, that the objective of the government has been to reduce business costs going forward. So we've done that in two ways. One is reducing or even eliminating the cost of employees for those businesses that have needed to close, those who are in the sector that this applies. And also we've introduced landlord discounts where the government is a landlord, or landlord rent waivers where the government is a landlord, and encourage private sector landlords to do the same. Now, in terms of catering, I mean, we need to see how the situation evolves, but there are some catering establishments that are actually doing very well at this particular moment in time because of the fact that there are delivery companies collecting food and delivering it to the homes of their clients. And my family and I, for example, over Easter rung up a particular establishment wanting a takeaway and told we couldn't have it because there were 43 more in front of us. And that was at 2 p.m. in the afternoon. So clearly there are some businesses that are doing well, there are others that are doing less well, and we need to see what final picture emerges when all this settles down.
Thanks, DCM. Our next question is for Dr. Awal, this time from GBC. Clinical trials for a vaccine began in the UK yesterday. We've been quite good at getting our hands on essential equipment and meds so far. But as soon as a vaccine is available, everyone is going to want to get their hands on it. How confident is the GHA that it will be able to procure stock in good time?
Well, I suppose the first thing to say is, of course, that will happen when a vaccine is produced, and of course, vaccines will not become widely available until any company, no matter how keen any company or any country is to develop a vaccine, we absolutely wouldn't put a vaccine available to the public if it wasn't safe. We are certainly working with the NHS and Department of Health and the Foreign and Commonwealth Office in the UK to secure supply lines through the NHS. So as a result, the plan there would be that we will become essentially part of the NHS, albeit that we're not in the UK, so that any medicines at all, because we just can't see what's coming around the corner at the moment. We've been predicting perhaps the use of hydroxychloroquine, and now the evidence is saying that perhaps that's not a useful one, and various other antivirals, and we're still watching about those going on. So this is not just about vaccines, this is about any medication that will come to the fore perhaps that may be useful in the fight against COVID-19, but we are certainly looking at that, and we're doing our utmost to secure supply lines for that. So I can't give you 100% confidence and guarantee on that one, because if a vaccine becomes available, I'm sure everybody will want it, but we certainly stand a very, very, very good chance of getting our hands on stuff if needed.
Thanks, Dr. Rawal. Our next question is for Deputy Chief Minister from the Chronicle. How will temperature screening at entry points work in practice? What will you do when people do have a temperature? What impact do you envisage it will have on border flow? And are the logistics of this being discussed with Spanish authorities too?
Well, first of all, let me say the Cabinet is now considering the details of the lockdown. Obviously, that will be done based on public health advice and medical advice, as we have taken every decision so far. Temperature screening is one of those issues that we'll be looking at, as Dr. Rawal has already explained, the technical aspects as to how that would work. But bear in mind that we may not necessarily decide to do them at the border itself. We may decide to carry out the screening inside, at some point inside Gibraltar, and also that it may not involve screening every single person, but screening people at random and seeing what the incidence of the virus coming into Gibraltar is. I don't know whether, Chris, you want to add anything?
No, I think that's absolutely right. You know, the logistics of this, and you know, if you temperature screen every single person, and there would be more to it really, because we would expect somebody who's coming in to have a temperature screen and perhaps alcohol gel, and make sure that everything is done right. But you can imagine hundreds and hundreds of people. It's a little bit like, imagine you know, going through border control in an airport and having to queue and queue and queue. And of course, then if we ask people to queue, then we're breaching all these social distances. So logistically, it's a tricky thing. And then what do we do with somebody who has a temperature? Because simply because you have a temperature doesn't mean you have COVID-19 by default. It may very well mean that you have a cough or a cold which is not related, or you have some other infection. So lots of these logistic issues, but the fact is that, as Deputy Chief said, these are going to be a normal part of our life, and certainly we are more than considering it. We just have to work out what's the best way and what's the best and most useful value of information that we get from those temperature screens.
Okay, thank you both. Our next question is again for Dr. Garcia from GBC. A number of bank holidays coming up. What lessons have been learned from the Easter weekend in terms of recreational activities for the general public, such as visiting beaches?
Well, I think in Easter we had a very good sunny day on part of Good Friday, and then the rest of it perhaps wasn't that good. But the advice we're giving people is exactly the same advice that we gave over Easter. You heard the Commissioner of Police, who was here with me earlier on this week. And essentially, you know, we will still be able to go to the beach, but we have to do so in a very different way. And for Easter, we advise people, look, you can go to the beach to exercise, you can go there for a run, you can go for a walk, you can go to swim, but you cannot go there for a picnic and go with all your, you know, food hamper and all the paraphernalia we take to the beaches, and I include myself in that. It has to be done differently. So I think this year, things will have to be done very differently, and we will need to look at going to the beach in the same way as everything else that we do, maintaining social distancing, staying there for a short period of time, and then going home.
Thank you, Dr. Garcia. Our final question today is for Dr. Rawal, and it's from the Olive Press. What happened to the fast tests that were partially developed by Nick Cortes, and if that is no longer considered efficient, why has local testing continued to lag despite the low number of swabs carried out so far, and the fact that we should have full capacity at the Gibraltar labs?
Okay, so in actual fact, as we've said on a number of occasions, we actually have 4 different testing systems. And the idea behind those systems, simply because we've got 4 doesn't mean we need to use 4. We use the best, most reliable of those tests. And there are 2 front-running tests that we use. One test that we use first thing in the morning for any swabs that have been taken overnight, and that will give us a response within 2 or 3 hours. And then the mainstay test, which can run more swabs, so we use that during the day for swabs which are produced during the day and come through the drive-through and from anywhere else. Primary care being a good example of that. So we run those 2. They give us very, very accurate results. Now the fast test that we're talking about, it actually started, the fast test, as a bit of a prototype, and of course. That's the thing. If you do a fast test, you have to accept that you may lose some of the reliability of that fast test. So the first question then is, where is the value of doing a test which can give you a response this minute in 5 minutes, when in actual fact in a couple of hours I can give you an answer to your swab which I can absolutely rely on at this point. But the fast test is being improved, it's being tweaked. We're working with Dr. Cortez in the UK, and he's working with his team in the UK to tweak things and improve the sensitivity of it. So in actual fact, like I said, we have these 4 platforms that we can use, and we will use them as we think is appropriate. So I would suggest that the fast test would be better used either for somebody who needs who's a patient who's very, very sick, who needs a response there and then, or perhaps with a frontline worker or something that we think, for example, with a temperature screening, maybe we've got a member of the healthcare staff that we need to check very quickly, because if we can't check them, maybe we're going to have to send them home. So really, these tools are really to be used in the most appropriate clinical environment. So I wouldn't say there's any failure in terms of this one. The laboratory are doing really good job with our testing, and as each of these things come online, we will use them for the most appropriate situation.
Okay, thank you both. There are no further questions today.
Thank you very much for your questions. Before I repeat our public health advice, let me say that tomorrow my colleague, the Minister for Health, Paul Balban, and the Director of Public Health, Dr. Sohail Bhatti, will be here to address you and to answer any questions that you may have. So thank you also to Dr. Rawal for being here with us this afternoon. So the advice is to listen and to act on the advice of our public health experts. When you sneeze or cough, do so in a tissue and then bin it. Wash your hands regularly for at least 20 seconds. Do not visit anyone over 70. If you are over 70 or vulnerable, please stay at home. If you need medical advice, call 111. If you have any other question, call 200 418 18. And for emergencies, call 190 or 199 as usual. Stay home, stay alive. Thank you.